how few of you are here. On the other hand, I totally understand that people want to go home on Mother's Day. It's been a long weekend. Now, you have had, I think, a lecture on the microbiome for preconception and pregnancy and birth and then breastfeeding, right? So I'm kind of taking that and going a little bit further into the infants, the young children, to talk about how important the microbiome is and kind of the bad things we do to interfere with it that can be absolutely avoided and should be avoided, because if we do bad things to the microbiome to a young child, that can have an effect much, much later in life. So I'll talk about the developmental stages of the microbiome and then the significance for health in the infant, but also in later life, and then some common medications and some common uses that are based on really good research for probiotics as a medical intervention. So we don't really know what a healthy microbiome is, but we do know that diversity is the best predictor of a good microbiome. The microbiome is as diverse as a fingerprint. We could, if each of you gave us a sample of your microbiome, we could know exactly whose it is, because there is no two people in the world who have the same microbiome. It consists not just of bacteria, but also viruses and parasites that are part of a healthy microbiome. So don't think that just only bacteria are needed. The best predictor of who is going to have the most variety in their microbiome is eating lots of different vegetables. So people on a plant-based diet have, in general, a better microbiome, unless, of course, they eat just, the burger without the bun without the burger. And then everybody has some bacteria that are considered bad. Everybody has some Clostridia. Everybody has strep in their gut, and it's not a problem. It is a problem when the balance is out, when there's too much of it. And the other thing I wanted to mention is biofilms. These bacteria don't grow individually as little, bacteria, but they live in colonies, and they cover themselves in kind of like a glad wrap to protect themselves from being attacked and killed. And now we think of the gut as kind of like a warfare zone, where one kind of bacteria like strep produces chemicals that kills off E. coli, and E. coli produces chemicals that kill off strep, and they're trying to get rid of each other because they each want to grow. And what we need to do is kind of feed the good bacteria, feed the variety so that they're all in balance. You already had these lectures about the transitions of the human microbiome. So at birth and breastfeeding, you have mostly bifidobacteria. And then once weaning foods are introduced, you get more of the Firmicutes and Bacteroidetes. They do influence of your immune development. So a child's immune system will only develop optimally if they have a good gut flora. And that's why giving probiotics early in life can actually reduce the risk of allergies, developing allergies later on. I'll talk a bit more about that. The adult type microbiome is established pretty early on. By the time the child is 2 years old, whatever microbiome they have by that age is what our body's immune system recognizes as their own. And we'll always try to get back to that. Okay, so anything else will be fought by the immune system. That's why it is so incredibly important that we do whatever we can do to promote a healthy microbiome in infants. And there are certain windows of opportunity when you can really intervene. So basically the first year. So you did hear the wonderful Leila Hechtman talking about how, that children, whether they're born by vaginal birth or C-section, doesn't matter that much. By 6 weeks, they have the same microbiome, more or less. But the first 6 weeks are actually incredibly important, and they have a different microbiome in those first 6 weeks. It may be balanced out by 6 weeks, but it is quite different. And once again, it's like a fingerprint. But there are certain, babies who are born vaginally have the microbiome of the mother that they swallow on their way out through the birth canal, whereas babies born by C-section have the microbiome of the skin of either the mother or the hospital workers. So very different at first, much more pro-inflammatory. And then if they're breastfed, that promotes, as you heard from Dawn Witten, promotes the growth of bifidobacteria, which is what we mostly want early on. If they're bottle fed, it promotes the growth of other bacteria. And even giving just one bottle of formula in those first few days completely disrupts that bifidobacteria-rich microbiome and can take up to 4 weeks to recalibrate. So really, if you can breastfeed, and most people can with the right support, do that. And if you have friends or daughters who are going to give birth, really, it's very important to get that message out that breastfeeding is what we're evolved to do. And, you know, it's really, we're the only mammal species that chooses to drink milk from a different species. You know, you don't see an elephant suckle on a giraffe. So the microbiome of the neonate does depend on the mode of delivery, and you have these slides if you want to go more into the research. There are certain bacteria that are more common in kids who are born by C-section and others that are lower. One I want to point out is the Firmicutes are more in C-section, and they're associated with obesity. And we do know that kids who are born by C-section are more likely to become overweight. We know that some of the Clostridia are more likely to make kids angry and have difficult behavior. So, you know, some of those things may already start out early on. But as I said, you have that window of opportunity in the first year to balance out the microbiome with best breastfeeding, good diet, maybe some probiotics. Clostridia are also associated with sepsis, so that's a severe infection in the early days, which can be fatal. And E. coli is associated with necrotizing enterocolitis, which I'm just going to touch on as an example of where pediatricians and all mainstream hospitals in Australia now use probiotics in the intensive care unit as the treatment, because there is no other treatment that works. And the way some of these probiotics work is, for example, the Bacteroides fragilis lessens inflammation by actually producing chemicals that stimulate anti-inflammatory interleukins. So there's a very, very intricate interplay between the immune system and the bacteria. So vaginal delivery, you have more diversity, which, if that's the one thing you take home today, is we want diversity, okay? And again, certain bacteria like Bacteroides that reduces the inflammation overall. And everything you've heard about this weekend here, any problem that we see in children or adults has to do with inflammation. We live in a hyper-inflamed state most of the time, so we want to reduce inflammation. Bifidobacter bacteria are the ones that babies should have predominantly in those first few months. You heard from Dawn about the amazing human milk oligosaccharides that promote very specifically the growth of bifidobacteria, and they decrease the risk of that often fatal illness, necrotizing enterocolitis. Bifidobacteria also help, so if a baby does receive a vaccination, they actually have a better immune response if they have lots of bifidobacteria. And it's anti-inflammatory for those nice, the lining of the gut, those cells, intestinal cells. And it decreases over time the permeability of the gut. All babies are born with a leaky gut. That's actually really important because breast milk contains cells and, you know, complex chemicals that need to go into the baby undigested. And that's why they have a leaky gut at first. But as the baby matures, the gut should become less and less leaky, the lining should become tighter, and only actually fully digested food should go through. And the bifidobacteria also accelerate the maturation of the immune system. And breast milk leads to diversity. Again, that's the main thing we want. They have more diversity compared to formula-fed peers. and that modulates the immune system. So now I want to talk about why we care so much about the neonatal microbiome, and the reason is that it is not just important for the baby, but also for later in life. And there's a lot of things we do to interfere with a normal, healthy microbiome. One of that is antibiotics. Okay, so antibiotics sometimes are life-saving, and I do sometimes prescribe antibiotics, but we all know they're overprescribed. For example, an ear infection, whether you give antibiotics or not, in 90% of cases, the children will be over that ear infection in a couple of days. But if you give an antibiotic, they're twice as likely to have another ear infection within 3 months. So that's the case when it's really unnecessary. Okay? Viral infections, you don't need antibiotics. Antibiotics don't work for viruses. Okay? And the other huge overuse of antibiotics, of course, is in raising animals. All the animals that are raised for meat or milk or even eggs are given antibiotics so that they grow faster, produce more. Not because of bacteria, but just because it's actually a growth factor for these animals. And we eat them with the meat and the milk and the eggs. So not great for our gut flora. So with the antibiotics, there are different kinds of effects depending on when they're given. But if you give antibiotics in that first couple of weeks of life, you increase the risk of infections, asthma, and allergies, and type 1 diabetes later in life. Also childhood obesity. And of course, you decrease the microbial diversity. Later in life, you probably don't have quite such a strong impact because, as you know now, by 2 years of age, your immune system sets to the microflora you have. And so if you give it later, you just have other side effects. So for example, if you get it as an adult or as an older adult, actually, you're at high risk of getting a Clostridium infection, which can be fatal. But you're not going to really affect your immune system as you do in the first year. So the other really important thing about the microbiome is that it impacts stem cells population. So stem cells are cells that that our bone marrow produces, and they can develop into any kind of cell. A stem cell could become a liver cell, a brain cell, a muscle cell. It hasn't really quite decided what it's going to be. And so that's why the microbiome actually has an effect not just on the immune system, not just on the gut, but on muscle cells, on adipose tissue, on bone development. So it really has an effect on our whole entire body. Necrotizing enterocolitis is a serious infection that I hope you'll never come in contact with, but it's just an example of how powerful probiotics can be. So it's an infection that very prematurely born babies usually get. About 7% of infants under 1,500 grams, and is kind of the most feared infection in the intensive care unit of newborns, because up to a third of those babies die. And the others often end up with short gut syndrome, where half of their gut is cut out, and then they can't absorb nutrients very well for the rest of their lives. So it is really a terrible, terrible infection. And probiotics reduce the risk by 77%, 67%. So huge drop, okay? So that's why in all intensive care units for neonates now, probiotics are used. And so the neonatologists have really gotten on board with that, and that's now trickling down a little bit to the pediatricians who are taking care of slightly older children. So I'm very hopeful that over time probiotics will become more part of everyday pediatrics. So the way the probiotics work, as an example with the necrotizing enterocolitis, but they work like that for any other problem, is anti-inflammatory, increasing gene responses that protect the cells, promoting the barrier function, and just overall antioxidant, anti-inflammatory, and cleaning up dead cells as well, which is a very important part of us, is apoptosis and cell death. So when our cells are dying and dead, they need to be taken care of and eliminated, and probiotics help with that. And last but not least, secretory IgA is an immunoglobulin that actually covers all our immune mucosa, so in the gut, but also in our mouth, and is the first barrier against pathogens. So it won't allow pathogens to actually invade through our mucosa if you have good levels of IgA, and that's what probiotics do. There are specific probiotics used for that, but you don't need to know that. But very similar probiotics actually work for children's health in general, infants. Now I want to talk, now that you understand kind of how probiotics work, I want to talk about some not simple, but common problems that are not fatal. Okay, they're not as serious maybe as necrotizing enterocolitis, but many more infants suffer from that, including colic. So the definition of colic is if a baby cries for more than 3 hours, 3 times a week for more than 3 weeks, they get the diagnosis of colic. The thing with colic is that if a child has that, they are at much higher risk of developing allergies, asthma, and recurrent tummy aches later in life. So a lot of the children I see when they're 6 years old who have tummy aches all the time, I ask what happened when they were infants. Yeah, they were colicky. And so the time to intervene is early on when they are uncomfortable, because babies are not evolved to cry unless there's a real problem. So about a quarter of infants suffer from colic, and it is treatable. So Lactobacillus reuteri in breastfed babies, if they're treated with that, they're twice as likely to not have colic anymore, to respond, compared to children who got, for example, a placebo. Okay, so it works really well. And there are studies that show if you just give infants probiotics at the first few weeks of life, it reduces their risk of allergies later in life. So you're doing something good anyway. But I think in colic it is mandatory to intervene. There are other things you can do for colic. For example, I love Iberogast herbal drops. They're kind of the bitters that everybody was talking about. Just 1 drop of that really reduces that bloating in the baby. And then, of course, lots of skin-to-skin contact. The more skin-to-skin a baby has, the lower their stress hormones, the calmer their breathing, the calmer their heart rate. So it's really skin-to-skin is incredibly important. In the intensive care units, in the neonatal, they do now kangaroo care, where they actually put the baby skin-to-skin and then close over the mom or dad, or sometimes the siblings who hold the baby skin-to-skin. And it just, because of their stress level going down, they grow better. They have fewer infections. They develop better. The other big problem we see is reflux. Okay, so reflux in infants is, every week I see kids who come with a diagnosis of reflux, and to me it's not really a disease, it is a reaction to something going into the system that the system rejects and sends it back up. Okay? And 80% of the time it's dairy. As I said, as mammals we evolved to drink the milk from our own species, and if the baby is bottle fed with artificial baby formula, or if the mother is has dairy in her diet, the children often react to that. Now the mainstream treatment for that is to give antacids, so lowering the acidity in the stomach, so still everything will come up but it won't hurt. But the problem with that is that acidity in the stomach is important for our health. It's important, first of all, to kill off bacteria that we're swallowing, pathogens, so the child actually has a higher rate of getting SIBO later in life, the small intestinal bowel overgrowth, but also just diarrhea from pathogens. That also we need the acidity to absorb iron and B12. And I talked earlier today how important iron and B12 are for our brain function. If a baby is iron deficient in the first year, and you don't treat it, they will never attain the same kind of development and IQ as they would have if they had had normal iron. So, and if you give antacids, you also cannot fully digest the protein in the stomach. That's where the digestion starts. And so not fully digested proteins will be presented to the immune system, and the immune system is likely to overreact and develop allergies. So 400% increase in allergies in kids who were on antacids. This is a brand new study that just came out this year. So really, the treatment of reflux should not be antacids if we can. And if you give antacids, just use them for a few weeks, not for years. I see kids who have been on them for 3, 4, 5 years, and they're incredibly unwell because all of the things I talked about. So much more physiological treatment options would be to carry the baby upright in a sling or in some kind of carrier, something close to the body, skin-to-skin contact, then eliminating dairy from the mom's diet. I find in 80% of cases, the baby's fine. No more reflux, no more colic. Okay? If that doesn't work, it may be other foods in addition to the dairy or instead of the dairy. So I always ask in the family, is there anyone who reacts to any food? Sometimes the dad was never able to tolerate egg, or the brother can't have wheat. And then we just try those foods in the mom's diet. I don't like to have moms on elimination diets for a very long time because when they're breastfeeding, they really need the calories. And I always make sure that they know what to eat instead so that they still get enough nutrients. But sometimes it's just really wonderful to see the response of the baby being able to breastfeed without being refluxing or colicky. And probiotics for reflux. Okay, as we know, probiotics reduce the inflammation. They help with the gut barrier lining. So really wonderful. And for the breastfeeding, what I also really like is that the laid back nursing technique. So we often have the baby below us breastfeeding, and then if you think of gravity, the head is not much higher than the body, everything comes back up, easily. But if you, here, I have the thing on there, it's heavy. So this laid-back nursing technique is where the mom just reclines on a recliner or on a couch or even in bed, propped up with some pillows, and puts the baby on top. And then the head is higher than the rest of the body and the stomach, and you won't have as much reflux because it would have to really go against gravity. And again, the Iberogast Turbo Drops, I just love them for babies. So a baby is born with a Th2 type immune system. Okay, our immune system it's very simplified by 2 arms, Th2 and Th1. Th2 is what you're born as, and Th2 stimulates release of histamine. So if you have a Th2 over active immune system, you get allergies. So, and then when your microbiome is good and you're exposed to a few little infections, but nothing too serious, you actually develop the Th1, and by a couple of years of age, by 2 years, you should have a very balanced Th2, Th1. And what's important for that? Bifidobacter again, okay? And also Lactobacillus rhamnosus. So in allergies, I said already, if you give children probiotics in the first few weeks of life, they actually have a much lower risk of developing allergies. It can also reduce the risk specifically of eczema up to 4 years of age. They have used Lactobacillus rhamnosus, they've used the E. coli Nissel, this is a Mutaflor, and there are also studies that actually show that it can help to treat eczema. But there are studies that show that didn't work. But maybe they didn't use the right strains or not enough of the probiotics, we don't know. But I do, when I see a trial with eczema, always try some probiotics along with lots of other things, and I find that it's usually really, really effective. Constipation, another really, really important common problem. We do know that Bifidobacter speed up gut transit times, so the poo goes through faster. The peristaltic movement in the bowel works faster, and the bowel motions are softer. And E. coli Mutaflor that's probably the most studied indication for the Mutaflor constipation, so really works well. And then diarrhea. There's a lot of research on Saccharomyces boulardii and diarrhea, also the E. coli. You can reduce the amount that someone has diarrhea by giving probiotics. Lots of studies on that, particularly in developing countries, because that's where diarrhea is a real public health problem because infants die of diarrhea. Now, the microbiome changes with age. We've seen the effects of, how the baby is born, how the baby is fed. And the next big transition is when solids are introduced. And what do you think would be better for the microbiome? These kinds of foods and a little donut for the baby. My mom said when my baby was, I think, 8 weeks old, give him some cake. Come on, don't be so mean. I said, oh my God, you really have no idea. So, of course, that's the kind of food we want. Vegetables, vegetables, vegetables. And the new approach to weaning foods is not shoving cereals with lots of sugar into their mouths with a spoon anymore, but it is baby-led weaning. Giving them vegetables that they can grab by themselves, because when they are ready to sit, grab the food and put it in their mouth, that's when their system is actually developed enough to have food. Now, there is a little bit of controversy about whether children should be, when we should introduce weaning foods, and the recommendation based on the research is 6 months. Okay, so 6 months of exclusive breastfeeding. At 6 months, we start introducing weaning foods, or around 6 months. And I know that there were some studies out there that said if you introduce peanut or egg earlier, there's a lower risk of allergies, but it actually was all reviewed by the Australian Allergy Association, and on their website they now say around 6 months. Diversity is the key to health. We want to get as many types of fiber, so vegetables, into that child so that they have a huge variety of bacteria growing in them. And fiber supplements won't work as well, or don't work. It really is the vegetables that work. A processed diet, so whole, white flours, white rice, all of those things, 40% less diverse within only 2 weeks of changing the diet, and it takes forever to go back to the nice, diverse microbiome. So if a child is on a really good diet and gets sick and goes to the hospital and gets white bread there, and all the junk food that we unfortunately serve in the hospital, it can take many, many weeks to get back to the nice microbiome. So avoid hospitals if you can. A plant-based Mediterranean diet is the most beneficial for the gut flora, so really work towards that. So that's the main message, really. So the gut flora of the neonate depends on how they're born, C-section versus vaginal. And the reason that is important to know is because I now realize there is a trend in Australia where women say, we don't have to have a vaginal birth. It's much more, it's easier on us to have a C-section, based on no research, because the research really shows that it's healthiest for the mother and the baby to have a vaginal birth, except, of course, in specific circumstances. But in general, much better for the mother as well. But there are now all these articles going around where they say, I chose to have a C-section because I'll recover much faster. And then they give you a story of a mother who had a faster recovery in C-section. But it is not based on any data. Same with breastfeeding. Unfortunately, there's a little bit of backlash going on, and people saying, breastfeeding is not sexy. But it is what we're evolved to do, and obviously the system, the whole system of the baby is evolved to respond to breastfeeding in the most optimal way, with the best development of the immune system and everything else, the brain, the muscle, everything, the kidneys. You name it in the body, it responds to breastfeeding. Probiotics are used for specific problems such as colic, constipation, reflux, diarrhea. And I hope you remember why antacids are not great and why we shouldn't take them for a long time, if at all. That the diversity is really the most important for health. And we need to get to that diversity, we need diverse vegetable fiber. Lots and lots of different. Only 5% of children in Australia get their 5 servings of vegetables a day. And a serving is a handful of vegetables, the size of that child's hand. It's not that much. And we really need to work on getting that into them, because that is the most important thing we can do for their health. And then remember that the gut flora is set to adults by about 1.5 or 2 years. So whatever we can do in those first couple of years, we should, to promote a healthy microbiome. And there are a couple of really useful websites here. If you want to just read some review articles, these are very good review articles on gut bacteria, on microbiome. But I also have the following 8 slides after that are all the references for the studies that I have been talking about. Thank you very much.
Thank you so much.